I want to run through an overview of participant follow-up in TACTIC now. So in the TACTIC trial, we are collecting information on case report forms at screening, baseline, dosing, which is on day 1, and then follow-up forms, day 2 through 14, day 28 and day 90. I want to just touch on a few tips about getting the information in on these forms. The first thing is just to remind you that although the follow-up forms days 2 through to 14 are all in there, we actually only want the intensive in-hospital follow-up while the patient is in hospital. Should someone be discharged on day 4 or 6, for example, that initial days up to day 14 are no longer needed. However, day 28 and day 90 are still required. A few points about collecting the data while the patient is in hospital. It's really important you try and get the data into us in real time, and that's particularly important because it allows us to, in terms of doing our interim analyses and also particularly looking at safety outcomes, we do that in a real-time manner. And also within those, our primary outcome, which includes our assessment of respiratory function, cardiac function, renal status, we want those in real time to come through to us. In terms of the other points I want to just pick up on and highlight, remember all patients coming to this study, we need to be cautious about VTE risk. This is not part of the trial, but everyone who comes into TACTIC should be managed according to their local guidelines around VTE prophylaxis. We're aware that there appears to be an increased risk of VTE in COVID-19. Also, ravulizumab. People who go into the complement inhibitor arm need prophylaxis against meningococcus. This is detailed in the study protocol and the trial manual, but that's the crucial bit not to miss while people are in that acute setting. One thing we've learned from doing COVID trials at King's, where we've had patients who are admitted, recruited perhaps on the admission ward, but then move through multiple wards during their hospital journey as they perhaps transition to higher care level settings. It's really important that the trial team follow patients as they make their way through the hospital, tracking them as they go through wards. This is vital for the adverse event reporting and to happen in real time. All of this and more is included in detail in the site initiation video. Thank you very much for listening.